Hey everyone, and welcome back. I'm really excited for today's video because it will feature some of the healthcare workers in my family, and we're basically going to just talk about their experiences, why they think this happens, and what we can do as viewers. And so without further ado, let's get started.
Hey
Hey
everyone.
everyone!
Yeah,
Happy New Year, guys! It's been so long!
I
Happy New
know.
Year to you too.
I miss you guys.
I haven't seen you in a while. How long?
Um, I think last time was when me and Rosie were staying up all night during the summer,
Oh,
Yes,
TikTok.
learning dances.
yes. Always doing TikToks whenever we're around, and it's
I
making
think
me
that was the
so
last time I saw you guys.
Long time ago.
But before we jump into things, I just wanted to take a moment to just thank you guys so much because you guys are literally the true heroes. You guys worked during a pandemic, and I can't even begin to imagine the emotional and mental toll and physical toll that took over you guys. So I just want to thank you guys for your service because you guys are literally the true heroes right now. You guys are really hard workers, and I'm proud of you guys, and I'm proud to say that I'm related to you guys. But also, with the holidays that just happened, a lot of people decided to go to parties and hang out with different people, and I know cases are rising right now, even with the vaccine. And so I feel like one of the main reasons why people are making some of these irresponsible decisions is because they're not there for they don't see things firsthand, so they don't really understand what's happening. So I just wanted to take a moment, if you guys are comfortable, just kind of explain how is it in the hospitals, because I feel like if people listen and hear what's really happening, they'll be able to start making more considerable and responsible decisions.
So, if we all could, I would like to have us all just say what we do, because I'm sure we're not all the same profession. I'll start myself. I'm a direct care worker for people who are disabled. I work in their houses directly. And so, though I'm not really exposed that much, like I'm sure other healthcare workers are, um, half the houses is a state-owned vendor, so half the houses, are dealing with that, and other houses aren't. Luckily, my house isn't. So it's been a discussion for some months now since COVID started.
My name is Rose. I'm a registered nurse. I currently work on a cancer unit for research. And during the beginning of the pandemic, I was redeployed on an oncology unit for cancer patients. But currently, I'm just on the oncology unit.
My name is Melissa. I am a certified nurse midwife, and I work in a couple of different settings. So the outpatient setting in the clinic and our inpatient setting, so labor and delivery, postpartum, and our OB emergency room.
So I work in one of the hospitals in Boston, and I know the beds are filling up pretty fast right now, seeing as how the numbers now are not how they were back in March of last year. We are over the top with capacity of the COVID units and the step down units, especially. Um, and I will say that every day we get an update of how many cases that are going on in Massachusetts as a whole versus how many beds are available. And I think the last email we got about 2 days ago, there were 7,000 cases in one day of an increase of COVID positive individuals that were tested. And the hospital itself, we test all of our employees, and those numbers are rising as well. Because obviously, if their cases are rising outside of the hospital, these people live at home and they're exposed to the virus. So it's getting pretty bad. And I agree with you, Kiana. People are not realizing how badly the hospitals are because it's just not as, I wouldn't say advertised, but there's not much concern as it was last year in March when everything was shut down.
So I think in the beginning when COVID started, I wasn't in the hospital as much because I had just had surgery. Um, but then I came back back in May, where it was still bad. But I think it was starting to fizzle out, but it was still bad. But now being in the hospital during the second or third surge, whatever we're calling it at this point, has been very interesting. I also work in a Boston hospital, and I work in a Boston hospital where a lot of the individuals affected are people of color. And I've definitely seen a significance on our unit. We are testing all, or we're recommending testing for all of our pregnant clients that come into labor or get admitted into our unit. Um, and a majority of the time, these clients are considered asymptomatic carriers. But I know, like, we've had situations where for a while everyone's getting tested, coming back negative, and then all of a sudden we're starting to get more of like, oh, now you're positive and you're positive and you're positive. And then, we're also getting individuals who are COVID positive and becoming really sick and they're pregnant. And although I don't work directly with the really, really sick ones, it definitely is impactful because you're not only just thinking of that person, you're also thinking of their baby that's inside, and you potentially have two clients and not one. So it's been really hard. I think um, as healthcare providers, you get a little bit of a fatigue, I feel like, but you're also trying to remain vigilant. But I also think that it's also very tough because you want to be the best that you can be for your clients. You want to be the best and give them that advice. But like you said, Kiana, with people not adhering to particular things, like that Thanksgiving spike and that Christmas spike was real. And I don't think people really recognized how real it was until it happened. So I feel like that was something where they were like, it's gonna spike. And like Rose was saying, we also get updates within our hospital about COVID cases and how many COVID cases are in the hospital and things like that. And then you just started seeing the number double and triple, and you're like, oh my gosh, here we go again. Um, but it's also very tough because I think people are exhausted. Like the pandemic has been here for almost a year, right? Because it kind of started around, it kind of hit us around March, so it's been here for about a year, and it's been hard. And I think you have a mixture of the fatigue and everything, and even with the introduction of the vaccine, it's like, okay, the vaccine administrations also has been a hot topic of conversation as well.
So in my house, being that my state is uh state my I'm sorry, being that my job is a state-owned vendor, um, you would think that we have it a little bit easier, but unfortunately, like it's not. It's still a little bit hard. The staff, we do get tested once a month, and even with the houses where some of the residents have gotten COVID and staff too, they're not testing them often, right? And they're not letting, if a staff has gotten COVID due to a resident getting COVID, it's not like they're going to have that staff stay in their house for 2 weeks. So now that staff is going back and forth, exposing themselves to other people. And then, they come into work. So before COVID hit, we were all floating. Like staff was going to different houses if they needed coverage. And I would say they stopped that in April. Like in beginning to mid-April, they stopped that because they saw how it was going so crazy, how it was spreading. They have certain nurses that work in they call them respite houses, which are houses where all the residents have COVID. So like, it's just like, you just want to be careful, but then those nurses are going back home too, right? And it's kind of hard too for the residents, because the residents before, they were going to day program, right? That was their only form of communication. A lot of these residents don't have family like we do. Some of them have been state-owned since they were children. So the only form of like communication and interaction that they could have was these day programs, but now they've stopped it. So now they're at home, and even though the staff try to stimulate them and still interact with them, it's a little bit harder for them to to cope in a way. So it's also like now you're seeing behaviors and stuff like that. And so just like Melissa was saying, like not only is the staff fatigued, but you can see it in the residents themselves.
Thank you for sharing. You guys opened my mind because there were some things that I wasn't even aware of, and I just want to thank you guys for sharing that. And I really hope that um, it it moves people to make more considerate and responsible decisions. Now understanding how hard it is on you guys, and not only you guys but the patients as well. As you guys know, I am doing a series right now where I talk about Black women in healthcare. I decided to break it down into 3 parts. In the first part, I talked about a case that had to do with J. Marion Sims, who, Melissa, you might know him since you are a midwife. He is recognized as the father of modern gynecology. He created things like I forgot the name, the speculum.
Yep.
And Sims' position. And turns out the way that he discovered these things were very controversial, as he used Black slaves as test subjects. And then in the second part of the series, I talked about implicit bias and how a lot of people treat different patients of color in different ways due to misconceptions that Black people don't feel pain. And then today, I just wanted to ask you guys questions, have people who are there and like working in those in healthcare, and have you guys share your experiences and why you think certain things happen. So thank you for taking the time out of your day. And I just have a few questions. Okay, so my first question is, what have your experiences been as healthcare workers? And that can be how patients or coworkers have treated you guys.
You go first. So I will I won't take away from the healthcare workers that have had it worse than me. And I feel as though I have grown up in the environment that I've kind of assimilated to the way um, people like me have been treated. So I have had certain situations that have occurred, and most of it is usually doubt from my patients when I introduce myself as a nurse. Like, if I were to enter the room, they are automatically assume that I'm either part of the cleaning staff or the kitchen, picking up their tray or cleaning out their trash. So I feel as though when that situation happens, it does make me feel away a little bit, but then I just kind of brush it off and introduce myself as their nurse. So, like I said, I know other people have had worse situations than me, but I feel as situations like that still kind of get to you because it already sets the tone for the day when you're first meeting your patient, and the first thing they think of you is not as what you actually are, and it's a higher stepping stone of what they're comparing you with, such as taking out the trash in their room. So most of the time when that occurs, I kind of just like rise above and introduce myself. Okay, I'm Rose. I'll be a nurse today. And then they have their questions like, oh, where did you go to school? Or, oh my gosh, you're so young. But I know the means of the questions are pretty much testing my capabilities of taking care of them as a patient. And I can understand that from a general point of view being a patient, but when it comes to the fact that it's more so geared towards the color of my skin or my appearance, you can definitely tell the type of patients that are more equipped to ask those certain questions. And there's been other situations too. I'm walking into the room with a coworker that doesn't look like me, but they're Caucasian, and they automatically assume that person's the nurse when they're that my coworker is coming into the room to help me out with whatever the situation may be. So I feel as though a lot of these situations happen, and it's different for everybody. And you guys can also explain your situations.
I've gone to predominantly white institutions, and I actually will say I didn't really, not that I wasn't aware racism occurs or things like that happen, but I feel like, especially in nursing, it is a lot more apparent, I think, than like where I went for my undergrad and other things. And especially as you keep moving up and doing your graduate studies and things like that. And, like Rose said, it's like you have a situation of, are you going to let this mess up your 12-hour, 24-hour shift? or are you going to just kind of address it and then kind of keep it moving? So it kind of depends. I feel like I've had situations where, if I say where I went to school, it's like, oh, you went there? Oh, you're too smart. And, and just, things of like people just questioning you and not really thinking that you are their provider, and I tend to be more of a provider who is like, I don't wear my white jacket. I wear my scrubs. I do my thing. I'm like, hey, I'm Melissa. I'm your midwife. And I think sometimes people really respond to that. And I think there's sometimes people who don't. But I think what is hard is when people expecting or thinking that you were somebody else. And then you are like, no, I'm the provider. I'm the one pushing. And they're like, where's the doctor? And I'm like, the doctor is dealing with another patient. And, like as a midwife, we are able to take care of you in all phases of your labor and postpartum care. I think it's actually funny because I feel like within this last year, I've had a couple of microaggressions, and it's been very eye opening. In regards to, I am definitely mama bear and I advocate for my clients in that way. And you guys are my family, so you know exactly what I'm talking about. And being called things such as aggressive, being called things such as, oh, you're doing too much, or things like that. And you sit there and you're like, okay, but if this was another coworker, you would say, oh, she is pushing the limits and doing this, versus me doing the same thing. It's being viewed as aggressive or me being too demanding. And it's very hard as a woman of color to play that card because I want to be the best I can be. But at the same time, it's like you're in these two worlds. So you have to learn how to communicate within these two worlds.
I will say, just another point of view of your question, how like minorities have been treated like in the healthcare. And you mentioned in your part 2 of the series about how it is assumed that like minorities or Black women or patients don't feel as much pain as Caucasians or other types of races. I will say I have witnessed like my patients that have been the minority are not taken as seriously with their pain request and just pain management. So if I have to page the doctor for anything that they're seeking or additional pain regimen, the doctor doesn't come as quick, or they're usually doubting that the patient isn't in as much pain as they are. Or for example, a patient that is withdrawing from drug overdose or drug abuse has legitimate pain because it is legitimate because their body is fighting off of those withdrawals, usually isn't taken as seriously when it's a person of color that's requesting more pain meds or management of the symptoms that they're experiencing. So not only with staff that it's happening with the healthcare, I believe, like you said in your part 2 of your series, that I've also witnessed a lot of the patients get mistreated because of the color of their skin.
And it's crazy because when we're in school, when we're in nursing school, CNA school, or anything like that, they're always, when it comes to pain, they're always saying it's subjective. We can't tell what that person's feeling. So if they say they're in pain, we have to take it seriously. We have to treat it as if they are in pain, you know?
Well, I also think like when you think about how people are being treated and perceived, and understand there's cultural things behind it too, right? So I think recognizing that within the medical field, you're taught these stereotypical things about different cultures, right? But also not being, it's like a different lens, right? So I'm a woman. I'm a woman from Haitian descent. So, like, and I was born in the United States. So I understand the American culture and I understand the Haitian culture. So when it comes to certain perceptions of pain or how people are feeling culturally, I recognize there's some differences. And it's important to have a healthcare worker that like looks like the clients that they're taking care of because of this very reason. Things can get lost in translation. And I feel that I've had even my own situations where I'm like, yeah, I don't feel right. and you're told, oh, but like your vital signs are okay. And like the first thing in nursing is, I don't care what your vital signs are. Like you need to look at your patient and you need to look exactly what they're going on, how they're feeling, how they're acting. Like if your person was able to do everything by themselves and all of a sudden they're like bedridden and like can barely open their eyes, it doesn't matter if their vital signs okay, that's a change, you know? And I think it's just the fact that, you know, there, even recently with medical students, I think within the last like 4 or 5 years, that there is a perception that Black people can deal with what was it that Black people, what was the thing that they
Is it
felt
like
that
they have a higher pain tolerance?
yes, a higher pain tolerance. And this is, we're talking about like the year 2000s, you know what I'm saying? Like 2010, 2015, that people are really perceiving that, hey, we have a higher tolerance of pain. And I think a lot of it too is, it's not, I wouldn't say it's a higher tolerance of pain. It's the fact that you don't want to be seen as that person who is demanding and asking for all of these things. You're like, you know, like, no, you're, however I deal with my pain, just because I'm more quiet in this. And I always tell all my clients all the time, like, how do you deal with pain? Are you someone who you have a high threshold? So like, if you're like, Melissa, I'm hurting, but you have a higher threshold and you're like communicating that to me, I'm taking it. So you always have to gauge and see where your clients are. And I think implicit bias in the workplace is so true. And it is so real because I've seen it. I've seen it with how people have been taken care of. I've seen it with just in particular certain reactions. Like one example that kind of comes into mind about biasness is more of like, you know, you might have a set of family where the dad might be very involved and asking all these questions and, oh, he's supportive and all of this. Then you have someone who is doing the same exact thing, but for some, their color of their skin or how they say it or what they look like makes them feel more aggressive or make it feel like, oh my gosh, I feel threatened, where it's like, no, like he, like that person is mad because their partner is uncomfortable. So you need to recognize there's a level of upsetness when it comes to that, versus automatically being like, well, I need you to calm down right now. No, no one needs to calm down right now, especially if someone's partner is uncomfortable, there's been a complication, and they are not feeling like their partner has been treated right or advocated for.
I see a lot of doctors prior to COVID, a lot of, if we, you know, we work with them, you know, if they're sick, you know, because some of them can't verbalize for themselves, right? So we can't tell if they're in pain, and if their vital signs look good, a lot of doctors will be like, oh, they're fine, you know what I mean? So it's definitely and with COVID, you know, sore throat and loss of taste and loss of smell is one of like the big symptoms of COVID. And now if we have residents who can't speak but they're behavioral, now, you know, it's really hard for us. And some of us, at least in my house, our residents don't get tested like the staff does.
Yeah.
And some of our residents, when they first got tested, which was in March, they, some of them would allow them to go in their nose, but the other ones were fighting with them, so it was very hard for them to get the test. So I just wanted to like bring that up. We do need to watch their behavior, and sometimes I feel like doctors or even nurses, no shame to you guys, won't listen to us direct care workers.
Well, you know what? Let's take it a step back. Let's say all in healthcare stuff, right? It could be the front desk, it could be the phlebotomist, it could be the cleaning person, it can be anyone in healthcare. And you always also have to remember to, you know, to play devil advocate, there's implicit bias in all healthcare workers, irregard and populations, right? So if you're like Rose brought up a good point, if you're working with someone with a substance use disorder, right? Doesn't matter what kind of healthcare provider you are. Some healthcare providers have perceptions in regards to people who suffer from substance use disorder. So, you know, they might say, oh, that junkie or that this, but not recognizing like, yes, they have a substance use disorder, but they're coming in and they're uncomfortable. So you also need to make sure that you are assessing what's actually happening and not dismissing them and automatically think that they are drug seeking, right? Because not every single time that's not the situation. You know what I'm saying? And recognizing that in healthcare, you have a lot of your biases, and you have to recognize those biases and know to say, like, okay, hold up, wait a second, let's see what's actually happening.
Okay, so my next question is, why do you guys believe that this happens in healthcare?
That's a tough one.
I feel like 2020 really like put a light on everything that pretty much was in the dark, if that makes sense, with just like systemic racism. I think that's the biggest reasoning that I have with what I have witnessed, and not just in the healthcare, but just in general. I believe that the people that are already in power kind of set a tone. And when I say in power, I mean like the higher ups, in a sense. Like the top, you don't see a lot of minority doctors. So the people that are already in the higher ups kind of set the tone, and they do the teaching to add to the next generation and the generation on top of that. So it all starts with who's your teacher, like who is setting the tone for healthcare to allow what's going on. And I've been lucky enough to have really great preceptors that have been open minded and never really belittled me in the sense to make me feel like my skin color was an issue. But I have witnessed just like certain teachings that occur with other workers, with their type of preceptors, and the people that are leading them and teaching them how to do their job, and how there's already like hindering racism in what they're teaching and what they're portraying to their students, in a sense. So I think it all has to do with who is starting this and who's continuing it.
I think that systematic racism and implicit bias comes in healthcare because healthcare was based on some of those founding principles. When you think about how it's always like, oh, well, this because of that, and because you don't eat well, this is what's causing this, but not recognizing, you're not going to eat well if you live in an area where there's no real grocery store. You're not going to eat well if you live in an area where there's constant violence and post-traumatic trauma that's coming from the things that are on in the community. So I feel like the reason why there is that implicit bias, there is a systematic racism within healthcare, is because healthcare was based on that, right? You talk about Sims, and you talk about, Henrietta Lacks, and all those particular discoveries were based on Black patients. You think about Tuskegee and the whole experiment with penicillin and syphilis, and thinking that Black individuals are less than thou, so you're going to go do this long research thing, and all of a sudden, so I feel like when you think about it and you think about everything that's been happening, it causes a lot. And I think that's where we have to break it down, because it's built within the core of medicine. It is legit built in the core of medicine, and just in healthcare in general.
Yeah, I totally agree with that. And with the systemic racial racism and like the socioeconomic racism too. Like she said, no one's gonna be able to eat healthy with no grocery stores, but you got McDonald's right there, and they got the two for $5. You have Wendy's on down the street. But on top of that too, their education isn't the best compared to where I grew up, which was a nice suburbs. It was a pretty affluent town. They had a great school system, so I got a good education, and I'm in nursing school. I'm getting my nursing degree. If I had grew up in an urban city, where it's a little bit more crowded, the school, the teacher, doesn't really care about my future or anything like that, then I'm not gonna really care about my future, so I'm just gonna think, oh, well, I got this job and I'm making X amount of money, so I don't need this. I got, I can buy my house, I can buy this, then that. So people aren't going to want to become nurses or doctors or go into psychology or something like that. When you're in the urban areas where it is predominantly Black and they're going to see, oh, I can make a G in one day by just selling these drugs. Why do I need to go to school? you know what I mean? And that is, I would say, like I said, I feel like to me that's one of the major reasons why we don't have a lot of minorities in these great positions. And I want to see that. Like, that's my future, for me to be able to bring my children to a Black pediatrician so that they don't feel awkward, or they can be like, oh my gosh, this doctor has the same hairstyle as me, like, I want to be just like her. That is like my ultimate dream.
And so my last question is, what can we do as viewers in order to change the system if we can in any way?
I think being responsible and just really asking and understanding why things are the way they are. I think questioning. Systems don't like to be questioned, and they don't like that pushback. But it forces people to really think of, like, why are you doing? How are you doing? What are you doing? I think I think it's important to just really recognize not everything is as how it seems. And I just think, as viewers, I think we really need to understand the education that we are being given in school is great. However, you need to step outside of that, and you really need to learn things outside of your comfort zone. For example, I give a task to the viewers that are going to be watching this. Look up Tuskegee, look up Henrietta Lacks, look up the forced sterilization of Latina women over in California. Look up those things, because that's not stuff that you're going to learn in school, right? And sometimes people are always like, oh, well, we've done this. Recognize history is more than just as what is actually taught in your books. So that is my thing for the viewers.
I will go off of what Melissa was saying. I agree with what she's saying. And I also think the most important thing is just sticking up for what doesn't seem right to you and asking the right questions. So if you see a coworker, or if you see something in, like, going about that doesn't really make sense, or it doesn't sit right with you, like, trust your gut and question it. It doesn't mean that it's are automatically gonna, like, lead to you getting fired or whatever the case is, but ask the right questions and stick up for your friends that are of color, or minorities in general. Just, like, give everyone an open chance. Just put yourself in their shoes for a moment and try and think, okay, if I was them, how would I feel in this situation?
Um, Really, you guys took all the words out of my mouth, and now I feel like I'm gonna have such a bad response. And they're like, I'm just kidding. But yeah, no, like I said, just look up those things, because I did a paper actually, um, for my course on the reason why African Americans don't really trust the COVID vaccine, and if we should. And I did fall under like the Tuskegee, and I learned so much that I never knew. Like, I didn't even learn in school. You know what I mean? So it definitely encouraged me just from reading those things. It did encourage me to want to go more into healthcare so I can be there for people that, don't have the opportunities that um, our other counterparts do. So I definitely, just like I said, I would just like more minorities come into healthcare and just be there for all of us so that there's some type of equilibrium or something.
Well, thank you guys so much. Thank you for just taking the time to talk to me. Um, Everything that you guys said, like, changed my perspective on things. I learned a lot, and I really hope that everyone watching this also learns a lot.
Okay, thank you too, Kiana, for taking the time out and giving us a
Oh
voice.
yes, most definitely.
And one more thank you to everyone who watched this. I really hope that you guys enjoyed this series, and I'll see you guys in my next video.